I have worked all over Canada, the United States, England, and Australia. I have worked in public and private care facilities and feel that we have one of the best healthcare systems here. What is your personal experience with private healthcare, and why do you feel it is a solution to our core issues, or why not?
My own experience is limited in private system. What I can tell you is that the world literature, the research evidence, is very consistent. Private care costs more. Ultimately, it delivers poorer results, and it's fundamentally unfair to those who can't afford it. And I think it's disingenuous of our Wildrose colleague to say that they're not planning to provide an alternate care delivery. Her leader has already said they would have a private option. They like choice. They like public money going to private options. And for our Conservative colleague here on the right to say that they don't support private options, we have a third of our healthcare system today privately delivered. I'm talking about eye specialists, I'm talking about psychologists, physiotherapists, I'm talking about Health Resource Centre, who operated the Grace Hospital after it was sold to them. The Wayne brothers, who were close to Ralph Klein, bought up the Holy Cross for a song, and they're now providing private services. This is a government that says one thing and does quite another.
So the question was about our experience with private health care. I traveled to my parents' home of India. If you want to see how fortunate we are to be Albertans and Canadians, wait outside of a hospital there. When you have an abundance of people pull up, go inside, get an idea of what the cost for treatment would be, and often leave without treatment. That was one of the most heartbreaking experiences in my life. When we were once visiting India, my sister got sick. And before any additional services were provided, we would have to cough up more dollars. Absolutely heartbreaking. And what I can say as a new MLA, with a new premier and a new leader, we support public health care, and the fear-mongering from my friends here is just incorrect. This is a clear decision between two parties. Two parties. Time is up. Thank you.
Thank you, Duane. My personal experience, unfortunately, I have had some personal experience in the private system because WCB utilizes private hospitals for surgeries, etc. I had an injury at work and I had to go in for shoulder surgery, and I was contacted a couple of days before and told that I had to go to the drugstore and buy some Nair and stuff and make sure the whole area where the surgery was going to be done was clean of hair. And then when I got to the hospital that day, they gave me a scrub kit and was told to go scrub myself before the operation. When I came out of surgery, I was still completely out of it, and my wife Patty was there to take me home. They told her, you probably wanted to roll the windows down on the way home because he's still coming out of the anesthetic and he might throw up out the window. So I don't blame the people that were working there, but it's indicative of the system when you cut costs at every corner you possibly can to make profit. That's the problem with the system. When there's a profit margin in there, dollars get sent to profit instead of care.
Thank you. I haven't had a lot of experience in the private healthcare system. I will say that my doctor's offices, the ophthalmologists are all private. I have a wonderful family doctor who has been kind enough to take care of myself and my aging mother at 88. Ophthalmologist that we go to has fixed my mom's cataracts and did a wonderful job on that. I think we have to look at, when we talk about the word private, I think people forget that our doctor's offices are private. We've got ophthalmologists, we've got, Dr. Swann has mentioned psychiatrists, psychologists, and all of that. So I can only tell you my experience is limited with private health care. We support, I've told you once again, we've committed to the public health care system. And I think we need to work on how we get more people to the front line so we don't even have to have this discussion.
I personally haven't had any experience with the private healthcare system. Again, we are very much about the public voice. We're very much about public access for all Albertans, regardless of any amount of money. We don't think democracy, and we don't think healthcare, and we don't think a lot of things have to do with how much money you have in this province. The entire Alberta Party was based upon talking to people and finding out how best they want their government to serve them and to come up with the platforms after we spoke to everybody. So that's why it's very much important that we actually talk to people and find out what are it's very important that we find out these things that are happening and actually be listened to. I find it disastrous and chaotic that the government that's currently in charge and other ones at the table here are wanting to go back to another system when we've been through 3 in the last 10 years. It is so costly. It'll take us back 3 to 4 years, and the accountability and the cost, both human resources for our health staff, for the schools, it's too costly to go backwards again. We need to stabilize.
Thank you.